Okay, folks, I think we're all set. Good afternoon, and thank you for joining us on this briefing. We are going to start off with a few comments from Mayor Kenny. Mayor, you have the floor.
Thanks, Mike, and good afternoon to everyone. Now, Dr. Farley is going to explain more about what transpired over the weekend related to fighting COVID and Dr. Johnson's resignation. We're somewhat limited in what we can share since now the matter is with the Inspector General. But I just want to say that the last 11 months responding to this pandemic have been very grueling for everyone involved, especially our health department, which has quite literally worked nonstop since the day our first case was detected. Overall, I'm very proud of the city's response, which was stymied for a long time by the lack of coordination and misinformation spread by the federal government in many, many ways. I'm also the first to admit that we're not perfect and we've made mistakes that we all deeply regret. But we are committed to doing better and restoring the public's faith in the city's ability to get our residents vaccinated. The same way we stood up testing and a field hospital, implemented hard but necessary restrictions, and everything else we've achieved with many partners since last March. I'm confident in Dr. Farley's leadership, and he has the support of myself and the entire government behind him. Before I turn it over to Dr. Farley, I want to remind the public that should anyone wish to report relevant information related to Philly fighting COVID issue, OIG investigators can be reached via telephone at 215-686-1770. That's 215-686-1770, or through email at oig@phila.gov. Now, Dr. Farley.
Thank you very much, Mayor. I am very sad to join you today to answer questions around the circumstances surrounding the resignation of Dr. Carolyn Johnson. Well, here's the chain of events. On Saturday, the Inquirer presented to us copies of emails from Dr. Johnson to Andre DeRochen of Philly Fighting COVID. And in one of those, she sent a copy of the request for proposals to potential vaccination providers and suggested an approximate budget. We later learned that she sent virtually the identical language at the same time to the Black Doctors COVID Consortium. Because these emails suggested that these providers may have had information not available to other potential applicants, I felt it was no longer appropriate for the health department to investigate this further. So I contacted the Inspector General, who then spoke to Dr. Johnson. Dr. Johnson acknowledged sending the emails and said it was in an effort to keep the budget requests from becoming too large. At that time, the federal funds for vaccination had not yet arrived. She recognized, though, that the emails could be perceived as an unfair advantage to these two potential applicants for funding, and she volunteered to resign. Let me just also point out what she did not do in those emails. She did not favor one of these organizations over the other. She did not provide information on how to propose a clinic operation plan or any other insider information. That was all in the request for proposals, and that was available to everyone. And she did not offer any additional vaccine doses to either organization. It appears that this was an attempt to simply move vaccine to people's arms more quickly and more efficiently. Nonetheless, these emails were not consistent with the purpose of a request for proposals. The purpose of request for proposals is to provide all information to all the applicants at the same time, so that some applicants don't receive some information that others do not. Dr. Johnson's leaving is a real loss to the Philadelphia Department of Public Health. She is an expert in infectious diseases. She is highly respected throughout the department and within the city. And she has successfully investigated and combated many other epidemics, including rolling out the vaccine for H1N1 influenza during that pandemic in 2009, a situation that was somewhat similar to what we're facing right now. And she led the vaccine team in the Department of Public Health. Now, the Inspector General will continue to conduct an independent investigation regarding the relationship between the Department of Public Health and Philly Fighting COVID. We will also cancel the request for proposals that's been put out there and reissue a new request for proposals so that all applicants have the same information at the same time. And we'll put in place a larger review team so that we have a very thorough review of all the applicants for funding. Now, I've redeployed others in the health department to a much expanded vaccine team that will be there to fulfill the duties that Dr. Johnson was carrying out, and also to do a better job of communicating to the various stakeholders about the vaccine rollout. We need to do a better job of communicating to people being vaccinated, to organizations delivering vaccine, to opinion leaders, to elected officials, to organizations seeking vaccine for their employees, to individuals seeking vaccination, and to the general public. Let me say, I realize the public is very frustrated by where we are. And I want to be clear what we are trying to do under difficult circumstances. We have three guiding principles. First, we want to get the vaccine into people fast. Second, we want to do it in a way that saves the most lives. And third, we want to do it with racial equity. And despite our missteps, we are making progress. We have now vaccinated approximately 100,000 people. In the past 6 weeks, we have nearly vaccinated as many people as have been diagnosed with COVID during the entire past 10.5 months of this epidemic. I do believe that the Department of Public Health, we can succeed in doing this. Now, I understand that we've lost some of the public trust with this latest event, but we ask people to give us time to regain that trust and to deliver that vaccine. I'll stop there. I'd be happy to answer any of your questions.
All right, thank you, Dr. Farley. Just a note to reporters, 1 second while I get my notes. We, as usual, are time limited. We are asking only one representative from each media outlet to ask questions. Reporters should limit their questions to 3 or fewer. And we have a hard stop time today of 1:30. So we are going to go first now to Mitch Blocker of NBC 10.
Good afternoon, everybody. Dr. Farley, with members of the legislature calling for you to resign on Friday, I know things have changed here. Is that still a consideration? Was that ever a consideration?
My answer to that question really is the same answer I gave you on Friday, Mitch, which is that I feel that I can still contribute to this response, but that I serve at the pleasure of the mayor. And if at any point the mayor feels that I'm not the appropriate person to lead the response or lead the health department, he can simply ask me and I'll be happy to lead.
And I'm not asking you.
And you talk a little bit about the backup plan to do mass vaccinations. Philly fighting COVID, as you, Dr. Farley, have said so many times, vaccinated thousands of people. What is the plan to vaccinate Philadelphia?
Well, for starters, you'll see starting on Wednesday how the health department can run mass vaccination clinics. We have had some that we have not invited the press to. You may not even be aware they occurred. We had one on Saturday that I visited. It was a very successful clinic. The health department will be running the clinics, which are the second dose clinics for the people who are vaccinated by Philly fighting COVID. That's going to be Wednesday through Saturday of this week, and then I believe Tuesday through Saturday of the following week. We will invite you to the clinic on Wednesday, and we'll demonstrate how the health department itself can run these clinics. In addition to that, we may look for additional partners. We will be looking for additional partners to run additional clinics. We know, for example, the Black Doctors COVID Consortium is running clinics. We're giving them additional doses for them to do that. And as more vaccine doses become available, we expect that other partners will be providing clinics like that. I should point out, though, that these mass clinics are just one channel of the many ways in which vaccine is being made available across the city. Hospitals are bringing in their patients and they're vaccinating them in their hospitals. Federally qualified health centers are vaccinating patients in their clinics. We have 26 Rite Aids that are providing vaccine. We will expand the number of pharmacies where people can go and get vaccinated. So these mass clinics are going to be an important part of our response, but they're far from the only part of the response.
And none of this is going to get much better until we have a larger number of vaccines. Part of the difficulty in setting up numerous sites for people to be vaccinated is when you only have 20 to 23,000 vaccines a week, you're going to disappoint a lot of people who show up because there's not enough to go around. And that's a remnant of the last federal administration who did nothing on this issue. And as soon as we can get Johnson & Johnson approved next week, hopefully, and more of a production, then we can ramp it up so that people can depend on a date when they're going to get vaccinated. But at this point now, because of the lack of vaccines, we can't do that.
And Mr. Mayor, this incident has not shed a flattering light on Philadelphia. What do you think the lasting impacts on the city's reputation will be? And Dr. Farley, I wonder, do you think this will affect how much vaccine Philadelphia gets directly going forward?
If you look at the facts, you will see that based on comparisons to peer cities, we vaccinated more people than every other city besides New York City. Our percentage of vaccines distributed are higher than any of the surrounding region. I think other than this unfortunate situation, which we've corrected, we've done a pretty good job.
Mitch, to your second question, I do not think this will have any influence on how many doses of vaccine we receive. Those vaccines are allocated on a per capita basis. People in Philadelphia certainly deserve vaccine, whether we've made a mistake here or not. And I think the federal government understands that.
Thank you, gentlemen.
All right, thank you, Mitch. Let's go to Nina Feldman of WHYY.
Hello, thank you for having us today. First question, Dr. Farley, you mentioned that neither of the two groups who Dr. Johnson was in communication with had an advantage at all. But Dr. Johnson in her email did mention that Mr. DeRochen could include a budget for his clinics that would have taken place before any sort of contract was awarded, which all but guarantees Mr. DeRochen that the contract would be awarded if he could include budget for them in his proposal. So can you explain how that's not an advantage?
Yeah, no, I did not say that this did not offer an advantage. I said that this was information that was not available to other potential applicants. And as far as saying that the cost of those vaccine clinics could be included in the budget, that does not guarantee that a review committee would determine that application was suitable for funding. It depends on how strong the application was in their operational plan.
Okay. Who is taking over for Dr. Johnson and what are their qualifications?
We have a very large vaccine team now. There's some 50 people that are involved in this. I'm leading the team, and there are several other physicians that are on the team, and every other member that was on the team before that Dr. Johnson was working on are still working on this.
Okay, but as the sort of head coordinator for the vaccine operations in that role that she was playing, there isn't a direct replacement.
At the moment, I am serving as the director of the vaccine team. Before it was Dr. Johnson.
Okay, and then last question, how many organizations right now are giving out vaccines outside of on a community level outside of the formal RFP process? And essentially how many people are doing what the Black Doctors Consortium is doing, what PFC was doing?
I'm not sure how to describe it. We have a variety of pharmacies that are giving out doses, maybe different sort of setting that they are outside of healthcare providers. We have hospitals, we have federally qualified health centers. I am not aware, I will double check, I'm not aware of any other non-hospital and non-pharmacy based community-based organization that is providing vaccination other than the Black Doctors Consortium.
Okay, thanks so much.
Thank you, Nina. Let's go to Jack Tomzik of the Metro.
Hello. This question's for Dr. Farley. Is all of this, Dr. Johnson resigning, the PFC situation and the reissuing the RFP, is it going to slow down the vaccination process in Philadelphia?
Well, we're going to try very hard to have it not slow down the process. Our biggest limit really is the number of doses we have. We're going to work very quickly, but we do need to work very quickly to get it in, and we may have to ask some providers to work without any funding, at least at first, so that it doesn't slow things down.
And there's been some talk about, missing doses. Are there any unaccounted for doses that were given to PFC that you don't know who was vaccinated?
So we have ways of reconciling how many doses were given, but they can't account for very small numbers because, as you may know, the number of doses you can get out of a single vial for some of these vaccines is sometimes 5, sometimes 6, sometimes 7. So we know how many doses went out, we know how many doses came back, we know how many doses were administered, but we never get them to entirely match. So we know that Mr. DeRochen acknowledged that he took 4 doses. I can't guarantee that there might not be another small number that he took off, but large amounts would have been picked up by that process.
And, when some readers first saw this story, they think that, Dr. Johnson's being used as a scapegoat here, that she's taking the fall for this. Would you say that's the case?
I would say, as a leader of the health department, it's my responsibility for everything that happens in the health department. I said that in interviews on Friday. I'll say that here today. Dr. Johnson was centrally involved in this, but there's no decision that's made entirely by one person. I would say that this working with this organization is a mistake of the department, and we've acknowledged that mistake, and we're working hard to both improve our processes so we don't make similar mistakes like that in the future, and to fix any problems caused by that mistake.
Right. Thank you.
Thank you, Jack. Let's go to Dale Mezzacappa of Chalkbeat. Dale, you have to unmute. Dale, there you go. You're
Okay,
good.
thanks. Sorry. Is there any progress being made on determining how and when teachers may be vaccinated?
We are thinking about how we vaccinate teachers. They are not next in the queue. We hope to have them, be soon, but we have many other people in the frontline essential category that we need to vaccinate. There's nothing I have to report for you today. I know it's very important to many people. We want to get teachers vaccinated. We are thinking that, but we don't have anything that enough progress that we can report on it here today.
So you don't have an agreement with a particular hospital, which you mentioned last week, is what your goal was, or any progress in deciding where they may get the vaccines or anything like that?
So understand that in view of these events here, we want to be extremely careful to not announce any organizational partnership without having a thorough review of that relationship. And so that's why I can't give you any news today about any partnership with any organization to vaccinate teachers, because we want to make sure that it's done in an entirely proper manner.
So the events that that you've talked about involving Philly fighting COVID have essentially delayed when teachers might get vaccinated.
As I said, I don't know that it's going to delay. It's possible. We're going to try very hard for it to not delay. We are certainly going to have to reset our processes so that we answer the concerns about whether there's we want to do it in a proper way.
Thank you.
Thank you, Dale. Let's go to David Murrell of Philadelphia Magazine.
Hi, yeah, this is a question about what happened on the day of the clinic that DeRosian, admitted to taking doses home. I know the health department has a policy where there's someone on site throughout the entirety of all clinics sort of watching over vaccine. I'm curious, does the health department have any more clarity on, what happened that day that, doses were taken home? I mean, was that person still on site at the end of the day when there were extra doses? What happened that day?
I know we did have staff on site throughout the clinic. I don't know any more details than that. And at this point, this has been referred to the Inspector General, and so it wouldn't be appropriate for us to investigate that further. We did have staff on site.
Is someone investigating or potentially interviewing the staff on site that were, present at the time that the doses were taken home?
I think it would be very likely that the Inspector General would interview those people. It's up to the Inspector General, but I would imagine he would interview those people.
The Inspector General is very, very thorough, and I suspect that he and his investigators will hit all the aspects of this issue.
Okay, and just the other final question I had, point of clarification, really. There have been, different accounts of who approached who to run the vaccine clinic in the first place. I had spoken with some city officials who said that it was PFC who offered to run the clinic, and then after they presented, application materials and had presented the requisite forms, they were the only one with the forms, and therefore that's the predominant reason why they were given the opportunity to run the first clinic. But I know that DeRosian has said in interviews that the health department reached out to him asking for help to set up the clinic, and I've heard similar things from other sources. So wanted to clarify which of those is correct.
Yeah, I don't know the answer to that, but that question about how we initiated our relationship with that organization, how it progressed, is really a core to what the Inspector General's investigation is about.
David, you good for the moment?
I'm good, yeah, thanks.
Okay, let's go to Manny Smith of CBS 3.
Thank you guys for this briefing opportunity to ask a couple of questions. I wanted to follow up on a few points. I know one of the talking points was that from the mayor's letter was that the 7,000 doses given to Philly Fighting COVID represented about 6% of the allotment that was, to the city. But I was kind of comparing that with to the number that was given to the Black Doctors Coalition, which was 2,500. Number one, who makes those allotment decisions? And number two, if we knew that there were issues with the minority community having access to the vaccine, the 2,500 doses seem a little low because if Philly Fighting COVID is getting 7,000, 6%, 2,500 is certainly closer to the lower single digits.
Right.
Yeah.
So the vaccine allocation has to do with what population is being vaccinated rather than being a sort of a prize to one organization versus another. The Philly Fighting COVID was brought in to vaccinate a very specific group of unaffiliated healthcare workers, home health workers, of which we had many. And if another organization were to operate that clinic, that other organization would vaccinate the same people. The health department was the one that invited those people to be vaccinated. So it wasn't that Philly Fighting COVID was given a vaccine and then told to vaccinate whoever you want. They were asked to operate a clinic, and then the health department directed people to go there. And likewise, if another organization went there, they would have vaccinated the same people. It was also true that the Philly Fighting COVID had their provider agreement completed by that time, and the Black Doctors COVID Consortium did not have their application complete at that time. Now, the Black Doctors COVID Consortium is claiming that they did not have an opportunity to complete it, that they were given information later in the game. And that's something which the Inspector General needs to investigate for sure. But the decision of the health department was to try to have a provider reach this specific target population. And that was a provider that was ready at that time to do it.
And doctor, could you describe the population we're talking about, these unaffiliated healthcare workers?
These are home health workers, tend to be very low income, often minority people who go into people's homes who are typically elderly and very medically fragile. They were a very important population for us to vaccinate because the hospitals couldn't do them. They're scattered in the community. They're otherwise would be difficult to reach them. And so we did, for reasons of racial equity and reasons of equity in general, want to really be sure we got them vaccinated. And that's why we set aside specific clinics so that we could reach them.
In the Philly Fighting COVID presentations, they had talked about, hey, having access to the stadiums for a mass vaccination site. Can you guys confirm you were in talks or in planning for them to hold even larger events at the sporting complex?
I had heard in one meeting that they had suggested a plan for vaccination clinics at stadiums. And the vaccine team told me they thought this was an overreach, that it wasn't a workable plan, and it didn't go any further than that. This event at the convention center was much scaled down from that, and the team felt that they were capable of doing that.
And as much as we appreciate the teams making available their facilities, we found in the testing phase that a lot of times people from the region come, not just Philadelphians. So we'd be servicing people potentially from New Jersey or from the suburbs when they would be better off being tested or vaccinated in their own county. But that's just one other issue relative to the large scale outdoor sites that are close to highways and the like.
And my last question is about City Council. It sounds like they are preparing not only for a hearing, but to roll out some administrative restrictions on how you guys disperse the vaccine. How are you guys preparing for that hearing and some additional accountability measures that might be coming from council?
Well, we have not had an opportunity to review the legislation. When we do, we'll do that today because we just got it and have comment on it then. I don't expect it to be any different than what our current procurement process is on other types of purchases. So we'll see what they have to say. They certainly have a right to weigh in, and we'll see what they're recommending.
Thank you.
All right, thank you, Manny. Let's go now to David Malandra of Philly Sports Network.
I just have one question for Dr. Farley. Last week, you mentioned about high school sports being back in action, especially basketball teams that have telling the players to wear masks during the game. Have there been any talks about with the college teams about making them wear masks during the game, especially for basketball players?
Now, with the college teams, we have taken a different approach. We said that they don't need to wear masks, but they do need to test their players with a rapid test every single day, so that when they go out there on the court, we have a high degree of confidence that they are not infectious and not going to spread it to other people. That option was something the high schools couldn't have. They just couldn't have the wherewithal to test everybody every day. And so the way that they handle it was everybody wearing masks.
All right, thank you.
Thank you, David. Let's go to Matthew Rothstein of BizNow.
Hi, and thank you. So as I understand it, the Philly Fighting COVID's clinic in the convention center, that partnership with the convention center was done just between those two entities and not coordinated by the health department. Is that true of every potential vaccination site? And going forward, for whoever replaces PFC dispersing doses, vaccines to that specific population you mentioned, will the city have any more relationship or control over where the vaccines are given?
I'm not sure I understand the question. The convention center, you're saying that the contractual relationship for the convention center was with Philly Fighting COVID rather than the health department?
So in previous emails with the health department, I was told by your spokesperson that the health department had no involvement in the convention center, in securing the convention center as a site, and and how to use the space, as in the physical setup. So I guess I'm asking for whoever uses that, gets the vaccine donations. Is the convention center still expected to deal entirely with another third party, or is the city in any way taking control or involvement in selection of sites from which to disperse vaccines?
So the health department will be operating clinics for the second dose of people who receive the first dose, and they'll be at the convention center. In this case, the health department will be working directly with the convention center about the layout and equipment and all that. So in that case, we are taking control of that relationship. The health department also, if organizations are operating off-site neighborhood-based clinics, we will engage in conversations with them about what are appropriate sites. But if we agree to them if they're operating it, then the actual contractual relationship around that site would be with that organization rather than with the health department.
But as vaccine doses become more available, and we are further into the neighborhoods, we want to make sure that sites are selected that make it easier for people to get there, either by public transportation or by walking. So not every site, for example, the sites at the ballpark will pretty much require a car. Not everybody has a car. So when we have a larger amount of doses to distribute and to inoculate people with, we'll have to keep an eye on the fact that we need them in locations that are workable, but also closer to the community so that people can get there readily.
Matthew, you're muted, so hold on one second.
Oh, no, that's fine.
Anything further?
No, nothing further. Thanks very much.
All right. We are just about out of time, but let's go back for a quick second round to Mitch Blocker of NBC.
Thanks, Mike. I appreciate it. Mayor, I have a couple more questions for you and one for Dr. Farley. Mr.
Mitch,
Mayor,
I'm going to ask you, Mitch, to keep them really tight because we are out of time, and
absolutely,
we have to go back to Nina as well. Okay.
Sure. Mayor, have you talked with the state delegation about their calls for Dr. Farley's resignation over the weekend, in the last day or two? And
yeah, I've had a number of calls. I've had a number of calls. I'm sorry, go ahead.
Oh, I just wanted to know, do you feel like Dr. Johnson's resignation has addressed their concerns?
I don't know that. I had a number of phone calls over the weekend with just about every person, not everyone, but just about every person. We had a meeting today, virtual meeting today with the Senate delegation, and I believe the House delegation is something maybe set up for Thursday or earlier. I certainly appreciate and respect their opinion. I think Dr. Farley and the team has done a really good job under very difficult circumstances, considering what they had to deal with for the past 10, 11 months coming out of Washington. I think things will get better now because of the Biden-Harris administration. Actually, we've got our vaccine allotment increased, not a lot, but increased just recently, which is a good sign. I take into consideration their views. I want to work with them. I want to make sure maybe we haven't communicated with them as often as we could. I mean, there's lots of things going on. There's lots of moving parts. I've never experienced a year like we've experienced. So perhaps we haven't been as informational with them as we could, and we're correcting that. But I appreciate their viewpoint. But Dr. Farley staying, I think he's done a good job. And I'm sorry to see Dr. Johnson go. I think she's a terrific person also. But I mean, certain things are over the line when it comes to the IG, and that had to happen.
Do you feel like this is an oversight failure, a systemic failure, an ethics failure, or do you think something criminal may have happened here?
I'm not an investigator. I'm not a public health official. So, I don't think anything criminal went on, certainly. I think whatever ethics breach it happened, and we'll get to the bottom of it. But I think it's a process that has been put in place. It hasn't been dealt with for 100 years. I mean, this is just, a simple public policy issue. This is multifaceted, multi-complicated, and never been done before. So we're going to trip up occasionally.
Is the health department still going to produce a report as requested in your letter, or is that now
Yes.
fully in the IG's hands?
I believe they are, Doctor. I don't know. I don't think the IG has supplanted the health department, but I'd like to see what both of them have to say.
Well, if I could just, Ms. Mayor, I just spoke to the Inspector General.
Right.
He said that because he's going to be interviewing staff and collecting information, he does not want us doing the same at the same time. So
Okay,
we can talk about a report based upon what I know, but I really need to not gather the information I would otherwise gather for a report. So we'll put out what we can, but it's going to have to be somewhat limited in view of the investigation by the Inspector General.
I mean, I thoroughly trust the IG, and he's extremely honest and thorough, and what his work product will enlighten us.
I wonder, is that going to affect the transparency? I know it was highlighted in your letter that this may be made public. Will this still be made public, the findings of any investigation?
The results of the IG's work will become public. The part of the process here is to give people a good sense that things are being done the right way, and you can't do that without transparency.
And Dr. Farley, I realize mistakes are made, accountability has to happen. Can you talk a little bit about what expertise you will be missing by not having Dr. Johnson around, and how you'll replace that?
Yeah, Dr. Johnson was, as I said, not just an infectious disease expert, but also someone who really had a very central role in our immunization program for many years, and played the key, was the key decision-making for the availability of the influenza vaccine in the H1N1 influenza pandemic of 2009. So I think that knowledge about the best way to think through the distribution of vaccine across an entire city is going to, take a hit with Dr. Johnson no longer being with us. However, we are fortunate that staff who reported to her were also there during the 2009 epidemic. And we do have other people who participated with her. So, I think her leadership is missing. And we also have medical experts, several medical experts that are part of the vaccine team. So I think that by expanding the team, bringing in additional people, we can make up for the loss of her to the department. And
also, we take advice all the time from the major medical facilities in our city and in our region. We have a plethora of folks who know this and know public health and medical health very well, and we take advice from them also. So we're not here alone.
Will there be more of an effort to tap into their advice, considering what has happened with Philly fighting COVID? You have world-class medical institutions.
It was happening before Philly fighting COVID. I mean, Dr. Farley's constantly in touch with all the medical directors of all our major hospitals on every issue.
Mitch, we're out of time, sorry, but I do want to get to Nina real quick. Nina Feldman, let's go back to you for our last questions.
Thanks so much. Can you just outline briefly what will be different about the new RFP? Will it still be funneled through PMHCC? Is there a different timeline? Are there different, what will the people who already submitted an RFP have to be kind of reorganizing their proposal to meet what new requirements?
We have not revised the RFP yet, so I can't give an answer to that. I can say that any of their applications they sent in before will not be considered. So they'll have to submit a new application with a new RFP. We want to make sure we do it right this time.
And will it still be funneled through PMHCC?
That's our current plan. What we want to do here is we want to have a fair process, but we also want to have a very rapid process. It's a very pressing need to get the support so that these organizations can provide vaccination. And that mechanism through PMHCC is a mechanism that can move very quickly, even though it can be fair at the same time. Other mechanisms that are available to us might take potentially months, and I don't think anybody wants to wait months in order for us to get these relationships in place.
Okay, thanks for taking the additional questions.
Sure. Thank you, Nina. And that concludes our briefing on the city's relationship with Philly fighting COVID. Tomorrow, we will resume our regular Tuesday COVID briefing on the general situation for both testing and vaccination at 1 p.m. Thank you.